The fact that each of us needs to eat for nourishment each day is a tether that keeps us together. And what could be more important than ensuring that that tether is strong, it's sound, and it's firm?
The collaborative is a vision that many have had over the years. It's a group of public health focused, passionate leaders of the regulatory retail food safety community in this country. We are aligning each of our strengths to bend the curve on the occurrence of foodborne illness within the retail food segment of the industry.
Well, the Collaborative is a group of 4 nationally recognized associations that have a vested interest in public health and retail food safety that have joined forces with 2 regulatory agencies, the Food and Drug Administration and the Centers for Disease Control and Prevention, to work on a variety of initiatives that are designed to reduce foodborne illness in the U.S. The national associations that are part of the Collaborative are the Association of Food and Drug Officials, the Conference for Food Protection, the National Association of County and City Health Officials, and the National Environmental Health Association.
We are excited to begin work on all the different projects the associations are working together on, because all of this will result in safer food. This includes developing a national food code adoption strategy and releasing a food code adoption toolkit, improving the approach, competency, and food safety culture within the regulatory community, increasing enrollment, engagement, and conformance in the retail program standards, improving foodborne outbreak investigation methods, increasing the number of establishments that have well-developed and implemented food safety management systems, and developing a strategy to enhance communication and better tell our collective story.
The Collaborative really advances food safety by bringing together some of the best minds, whether it be from regulators, the federal agencies, or even the industry, to come together and think about how we might solve some of these fundamental challenges to retail food safety.
I think the greatest challenge that we've always had is getting the maximum out of the limited resources we have available. And I think through this collaboration, we are able to develop a synergy that enables us to all do more and collectively have a much greater impact than any of the associations would have been able to achieve individually.
It's very important to industry members as far as providing safe foods to customers, which are also our friends, our neighbors, our relatives. And so if we can improve conditions and knowledge in the United States about what causes foodborne illness, how to prevent foodborne illness, and how to educate and get information out to not only our regulators in the industry and our customers, we're all better off for it.
Food safety impacts us all. We all eat. Further, all of us get food from restaurants, grocery stores, institutions, and other locations that are regulated by retail food safety programs at the state, local, tribal, and territorial level. The SLTT food safety staff are on a daily basis reducing the potential for foodborne illness. And this is really what public health is all about, stopping illness at the lowest level possible.
78% of local departments have provided regulation, inspection, or licensing services of food service establishments just in the past year, indicating that retail food safety is an essential public health service.
CDC estimates that 1 in 6 Americans get foodborne illness every year. And the cost of those foodborne illnesses are estimated at $15 billion. And CDC also estimates that if we can reduce these infections by just 10%, we can save 5 million people from getting sick every year. And that's a lot of missed school and work that we could prevent if we could reduce foodborne illness infections.
I believe it's really important to understand that environmental health is profoundly local. Food safety is profoundly local. Think about it. No one eats at the federal level. No one eats at the state level. They eat at the local level. They eat in their school cafeterias. They eat in their home kitchens. If you're in the military, you eat in your local mess hall. The decisions that each of us make as individuals around food safety are critically important to the health status of us and our families and our communities and the region writ large.
The collaborative supports a more robust engagement in the priority setting for the entire retail food safety system. The early stakeholder engagement helps to ensure the right priorities are being chosen and that most benefit the state, local, tribal, and territorial food safety programs that are responsible for regulating at the retail level. In addition, it promotes collaboration amongst all the regulatory associations, which can only further advance retail food safety.
This is a special time in history. We are establishing a foundational legacy for retail food regulatory partners in this country. This is the beginning of a new era of collective efforts in collaboration.
The benefits of becoming involved is that, number one, you receive intelligence as it develops through the work of the collaborative. Number two, you are provided best practice. What are the emerging knowledge, skills, and abilities that will inform retail food safety moving into the future? It's being part of a network of people committed to retail food safety in the United States. It is the best thinkers and doers, and who wouldn't want to be a part of that? I think the benefits of participation and association with the collaborative are profound.
This collaborative also allows us to have a seat at the table and discuss very important objectives to help the collaborative meet its goals and therefore improve food safety and also reduce foodborne illnesses in the United States.
I'm inspired that there is not a better time than now to have impacts in retail food protection. The work of the collaborative is directly contributing towards the goals of the new era for smarter food safety, modernization of traditional retail food safety approaches. I am excited for the collaborative to be a partner in this national retail food safety platform together.
Each of us has an important role to play in retail food safety, but we are much stronger together when we can align our message and align our efforts and align our work and speak in a common voice. And this is where the collaborative really shines. And this is a once in a professional lifetime opportunity to work shoulder to shoulder with our counterparts in the public health enterprise to do something that's profoundly important for communities everywhere, for families everywhere, for parents everywhere. And that is to ensure that the food that you put in your baby's mouth is safe, it's wholesome, and it's nourishing.